Hi, everyone. We're going to go ahead and get started. Welcome to Mind Matters, Navigating Cognitive and Memory Challenges in DM2. My name is Annalise, and I am an intern with the Myotonic Dystrophy Foundation. Dr. Puwanant is a physician, scientist, and neuromuscular specialist at Wake Forest University. Her research interests have focused on understanding the neurobiology and relationships between brain and muscle manifestations and developing biomarkers to determine disease progression and therapeutic responses in patients with myotonic dystrophy type 1 and type 2. She's also actively involved in clinical trials in DM1. Now, please give a warm welcome to our presenter, Dr. Puwanant.
Hi, everyone. Welcome to the session. It's called Mind Matters. We're going to talk pretty much about what the brain does in DM2. But before that, I want to thank the organizer and organization Myotonic Dystrophy Foundation for giving me this opportunity to give a talk. And I thank all the DM2, everyone, caregiver who participated in the study. And hopefully we'll move this field forward. So this is my disclosure. So today we're going to talk about what is DM2, myotonic dystrophy type 2, and how can DM2 affect our thinking, memory, because it's muscular dystrophy. And we're going to go through what is the common cognitive symptoms, what is previous literature talk about, and what we have found in our study, and what should we look for who experience the symptom or who may not yet experience the symptoms. What research tell us, and how can we better understand the impact of the brain involvement in DM2. And we're going to end with a little bit of tips for navigating challenges. There is no current treatment, but we could modify a lot of things to make our life easier. And then we're going to talk about some resources and support. So myotonic dystrophy, DM1 and 2 is the most common adult onset muscular dystrophy. And we all know that both types shares some similarity, right? But actually, DM1 and DM2 are completely different diseases, at least in my experience. It's the different genes. They share some common clinical features. Number one is muscle weakness, right? Progressive muscle weakness in DM1 is distal, meaning that it's starting from far away from your body, going to your core. But DM2 is an opposite. They share some features of myotonia, and they share multisystemic involvement, but it might not look the same. GI symptom or cognitive symptom in DM1 and DM2 may or may not look the same. They may share some, but they are not the same. So the main organ is muscle, heart, and brain. And today we talk about brain involvement. And both DM1 and DM2, we know that brain cognitive involvement has been increasingly recognized and being focused. It's pretty clear in DM1, right? But for DM2, I know many of you have experienced some symptoms and have brought it up to your doctor. But then, sometimes the feedback might be this is muscular dystrophy, and the vague symptom that you experience might not be recognized because of DM2 is more rare than DM1, and it's even more rare to have the doctor who understands DM2. So I guess that this has been brought up to our attention quite a lot. And you're absolutely right. The symptoms in DM2 are very subtle at first, and sometimes even the patient themselves is overlooked. But then retrospectively, when the symptoms are very clear, then you say, oh, yes, I remember that. And it happened. So yes, muscle is the main symptoms, right? It's the main features, but you also can have cardiac involvement. You have insulin resistance. You can have metabolic syndrome. You have early onset cataract. The GI could be a very significant symptoms, both DM1 and DM2. And then for the brain perspective, you have some people complain about brain fog, cognitive issue. They couldn't do what they used to be able to do it very good 5 years ago. And in terms of sleep, some people has daytime somnolence, some people don't, but many people has fatigue, very severe fatigue. And it's not clear if fatigue is actually a muscle source or is actually a brain source. And they have evidence about sleep in DM2 is not about excessive somnolence or sleepiness, but it's more like sleep inefficiency. And that because you didn't sleep efficient at night. So in the morning, you could be fatigued and feel some sleepiness as well. And there's a very limited evidence about brain imaging in DM2. I think the biggest study that has been done was from Germany, and that was back in 2011. So that's quite some time. All right, so you all know this is DM2 is a mutation of CNBP gene, which formerly called zinc finger 9 protein gene. So the repeat of DM2 is different from DM1, right? DM1 is 3 CTG, and for DM2 is CCTG, right? So it's 4 tetra. So it keep repeating it. And in normal people, like people who don't have DM2, usually they have these CCTG repeats about 11 to 26. And then for anything that above 75 repeats is usually pathogenic. But in general, when you get the genetic report from DM2 back, sometimes it's 10,000, greater than 15,000, or if you could go even more. So the repeat is very long. And oftentimes nowadays, genetic company might not even chasing to exact number. Some will go above and beyond than the other. And sometimes you might just get the report like greater than 75 positive. But some company will give you like, okay, 18,500. So it depends, but it wouldn't change the diagnosis. So because of these repeat form like a hairpin structure in the nucleus, so it attract a lot of muscle protein that's supposed to go out to the cytoplasm, which is outside of the cell of the nucleus. It got stuck into this hairpin loop structure. So in the muscle, you will see this clump that not supposed to be there, like a pink clump that it's basically is called toxic nuclei in the nucleus, and it's prevent necessary protein that's supposed to go out and working properly and is not working. So what we know about mechanism of myotonic dystrophy type 2, we know that the clump of this pink dot of the toxic foci, it's trapped RNA binding protein. So it didn't go out, it didn't work. And, it causing something called splicing abnormality. And if you splice in different organs, that causing different problem. So if you have splicing in the chloride channel, it causes myotonia. And you have splicing in your insulin receptor, it causes my diabetes, or insulin resistant. In the calcium channel, it could cause muscle weakness or atrophy. And we know in the heart, it is splicing in the sodium channel, and it could explain cardiac arrhythmia. So this is something being known for several years, and it's pretty much explained both DM1 and DM2. But one thing we don't really know, it was about the brain. We don't know what exactly going on in the brain and what splice, what kind of protein that got spliced. I would say, no evidence for DM2. So now we talk about cognitive symptoms in DM2. So this is what people usually say. They say that people in DM2, sometimes they might feel foggy, brain fog, they're not clear. Sometimes they're forgetful, brain fatigue, brain drain, overwhelm. So these kind of symptoms that they feel when they take it to the doctor is not really objective. So oftentimes, either they're saying that depend. Some people could in the 60 or 70 and they say it's aging, right? And some people would just maybe is something else. So because of you don't have problem indeed with memory, or maybe you do, the way we express things is might not clear. So this is very common finding, and like MDF has reported, and many people with DM2 always complain about brain fog. If you talk to the patient, they could give you a very specific example. Like I have a patient who used to work in China and America, and she was able to speak Mandarin and English, but she's American, okay? And then when she reached like 50, she lost ability to speak Mandarin. If it's not her mother tongue, but that could be something that she used to be able to do it. Some people express like they used to be able to run multitask, planning well, and then suddenly they lost that ability. And we have not long ago have a patient who came back for the study. We saw her 3 years ago and now we saw her again. And she told me that I stopped driving. And I say, oh, why? Because of your leg get weaker and then you have difficulty getting in and out of the car? Because I thought that would be the reason why she stopped driving. And she said, no, because of when I drive to the street that I'm not familiar, then I just couldn't get the direction or register thing. So I think that is actually giving you a little bit hint that 3 year past, there is something changes in her symptoms. And that could be part of executive function because of she can't plan, she doesn't know, like in the family road, she okay. Outside of that, then she's couldn't really see things well. I would tell you that these symptoms are valid for sure and real. Okay, so if no one tell you that there is no brain involvement in DM2, that's not correct. There are. Might not be for everyone. It's the same thing with cardiac, right? Not everyone has arrhythmia. But if they do have arrhythmia, it's DM2 related, right? All DM2 has muscle weakness. And the brain, I'm not saying everybody has to have brain symptoms, but if they do have it, it's probably DM2 related. So people with DM2, what kind of difficulty they could have? So they could have difficulty planning or managing time. They might miss deadline, maybe miss appointment, don't remember what they want to do. If they don't have a grocery list, and even though they have grocery list, they might not finish up. And they could have problem solving and organizing tasks. What I'm saying this is comparing to what they were able to do in the past, right? So they may be able to do everything fine. And then when they are about 50 years or sometime a little bit later, then these skills start to be more obvious. So they could have problem with focus attention. And sometimes they have problem keeping information even just a short time. Like for example, you might want to remember phone number, or you might want to do like a math in your mind, and you used to be able to do it very quick. And then at some certain point in the disease, you might not be able to do it well. Remember phone 7 digits and try to dial it. Not happen to everyone. So what previous research tell us is about almost 2/3 of patients with DM2 that reporting that they have brain-based symptoms, right? Either brain fog or anything brain-based symptom. And these came from the study of Dr. Heatwell from Rochester that he collect all the patient-reported outcome, and about, I would say 65% of patients with DM2, they reported this. When you take this group and you test that cognitive testing, it's about 2/3 of these, which is, it's not everyone has abnormal cognitive testing. About 1/3 still have normal. So it's not a DM1 group, that those are very obvious. But even these little things, tasking, planning, remember things short term, or organizing is have a high disease impact in quality of life for patients with DM2. There are some overlaps between cognitive theme or domains of DM1 and DM2, but it's not all. And we don't have a lot to tell, right? Because we don't have research data in DM2. So we hope that we could clarify that. So what we know about the brain pathology in DM2. So the top row is DM1, and this came from a paper quite a while ago. They did brain autopsy in DM1, and they have brain autopsy in DM2. So what they see is something like a brown clumping in different part of the brain. And it looked like in DM1, there is this brown spot all over. And in DM2, there is brown spot too, except for one area that DM2 didn't have it and DM1 has it. Basically, it's a small part of the brain that control like balance and coordination. So this is the only thing that they describe in this study, that, you know, they see abnormality in both of them except for one area, which is fine. One thing that's very interesting is this. They found these brown dots. So this brown dot is called tangle. So The full name is neurofibrillary tangle. So it's part of the neurodegeneration. So, it's non-specific, but we found these finding quite a lot in people with different kind of neurodegenerative diseases. Parkinson group has it, DM1 clearly has it, and people with dementia has it. But DM2 doesn't have dementia, but there are shared pathology. So we know that it's not, these brown dots shouldn't be there in the brain, but they're there, for DM1 and DM2. And we know that there is some protein, it's called tau protein. And this tau protein is usually connecting with memory, with cognition, and it has some cross pathology with those neurodegenerative disease, as I mentioned. And we know that in DM1, it was pretty clear that the tau protein, there is something called abnormal splicing. You splice in different things that I mentioned, and it causes symptoms. So it could be possible that if the RNA splicing is spliced in the tau protein, then that might explain all these things. So clearly that there are some shared pathology between DM1 and DM2. And we found a little bit other things, which is like this small little tiny dot. It has a fancy name, it's called Marineso body, but basically it's non-specific finding. What is interesting is that we found a lot of these brown staining in people with very old age. So the more we're going to have it, like I'm going to have it in my brain, like when you're getting older, this brown spot, it's called Marineso body, is getting more and more. So that's why there's a hypothesis that, so this look like a little bit of aging that kind of getting it to the point before, like for example, when people has problem with executive function, when they are having a difficulty planning, they should have that maybe when they are 70 something, but maybe DM2 has that symptom a little bit earlier. And that kind of makes sense when you see all these staining of this Marineso body a lot more in DM2 when it's not at that age that it should be showing, right? So we have some limited data of brain imaging in DM2, and most of those studies are small sample size, like 10, 20, and the result is pretty inconsistent, and they're not really quite clear, are they related to cognitive or not. Majority of the literature, they said that the brain that they see, there is something that looks like a white dot. I don't know if you guys see it here. In the picture B, you see there's like a wing of the white matter. White matter is non-specific. If you have diabetes, hypertension, you have some stroke, or you have multiple sclerosis, you can have this white matter like dot. But it looks like DM2, they're quite, the main abnormality is in the white matter. And the white matter is a lot of fiber. Think about the train station. You're going to go one train station to the other, a connection. So it looks like the white matter is connect a lot of area in the brain. So if you have a problem with the connecting issue, then, that might affect your cognition. This is not a dementia, and this is most of dementia. The problem is on the surface of the brain that, people with Alzheimer or with other things, but DM2 is not. DM2 is more like the problem with how the top of the brain talking to the bottom of the brain is more like a connection. And this is based on previous study that they see that, okay, one thing that very different, I point this out, global IQ. DM1, if you more like juvenile onset, congenital, or early onset, it's affecting your IQ. DM2 IQ is normal, and you guys has done very good. I don't want to tell you that in my study, DM2 has like very high educated. The education years was so high, and they got a lot of, they're doing very well, right? But so their global IQ was normal. The problem with DM2 that people has been described is executive function. And we're going to talk about what exactly executive function mean. And DM2 also have problem with focus attention. Some people complain about difficulty word finding. And some people saying that I used to be able to do 4 tasks in shifting between things very quick, and now I have to do one thing at a time. I'm slower. So we're going to look at it. I'm not telling you the result of the study, but what I'm telling you is that what we actually try to work on in the brain in DM2 is that we do have a study that called Brace DM2. It's come from brain structure and cognitive endpoint in myotonic dystrophy type 2. So we ran this study in North Carolina, like Winston-Salem, which is on the west part of North Carolina. It's a small town, but it's pretty beautiful, small. So the study is aimed to enroll 40 DM2 and 40 age and gender match control, okay? And it's supposed to run for 5 years. We are in year 3, and look at this. Thanks for everyone who come to Winston-Salem. We have 34 DM2. We're not even finished year 3 yet. So we are ahead of the control. And that is the normal things, right? You want to enroll the subject, then you match the subject, age and gender, and then you get the control. The control you can find local, right? But DM2, thank to all of you who basically travel, spending the time and everything to come to Winston. And I didn't expect this going to be yet finished up even earlier. So among 40 DM2, we plan to collect spinal fluid because of this is the only thing that would connect you to the brain, right? And you could get the fluid and sample it out. We're not sure if we could get 20, but guess what? We already been up to 20. So everybody is willing to like do a lot of things above and beyond, and I really appreciate it. And we collect all the blood, which is we're looking at the spinal fluid biomarker, we look at the plasma biomarker. And we even have 6 people that came and did the pilot study 3 years ago and willing to come back. So we get a little bit of different aspect of data to look at it. And this is quite excited because of data analysis is ongoing. We're almost done, but we still enroll. So we still need some people. So this is the study, how the study run. So because we want to know if the brain structure is changing, so we need to do brain MRI. So we have patient come and it's one-time study, right? Because we want to make sure that, you know, people with DM2 compared to control, are they the same? Are they different? Subject will come and do the MRI brain and it take about 50 minutes. And with the MRI, then we run the scan and we look at the brain. We look at different part of the brain, and then we run something that called diffusion tensor scalars. So this is a very special sequence that we look at the connection in the white matter because we want to know is this the problem is because of the surface of the brain or because of the connecting from point A to point B or B to C. And then everyone is going to get the cognitive testing, and we use the NIH toolbox, which is has been very well validated in different other studies. So it's an iPad, and it's pretty much self-explained. It takes about 45 minutes, and then we collect all the motor function. We have patient-reported outcome. We collect blood, and 20 of you have donated your spinal fluid, and thank you for that. All right, so the study is still ongoing, and we actually still need maybe 4 or 5 more, and we'd be done. So I'm gonna actually do some introduction about the brain. So this is because of this is for patient conference. So this is our brain, right? We have different part of the brain. The brain is like 2 sides, left and right connecting. There is something that connect left and right brain in the middle, and we have the front part of the brain, the side part of the brain, and a little bit on the bottom and the back, okay? So this is just to tell you that brain has different lobes, different regions, and each region is responsible for different things. So when you cut the brain in half, this is, you're looking at from inside, right? So you're gonna see that there is something look like a moon shape in the middle, and that is connecting between left and right brain. And that's a lot of things that call white matter, deep part of the brain. And just to give you an idea that on the roof part of the brain is called cortex, and pretty much those are gray matter. And then after that, coming inside is white matter, and you could see that it's like a fiber. So it's almost like the fiber is like a fan, and then it's become denser, and it's coming down to the deep part of the brain. This is something that we will confirm later when we have all the subject completed and we do the final analysis. I think the problem with DM2 is within the white matter. So what I'm showing you here is if you see the area of the yellow orange and also in the blue in the bottom, this is we compare you with the control. The control is someone who's, age and gender match with you, right? Because of the men has a bigger brain than women. So we have to match with the gender and age. So the yellow and the orange area is telling me that this is the area that the white matter is not healthy in DM2 compared to control. And same thing in the blue, right? But you can see that this is something that is not like Alzheimer. The pattern of the distribution of the white matter is different. And it's look like it's like a global phenomenon because you see it in the front, you see a little bit in the side of the brain and in the bottom of the brain. So this is something that we don't know what exactly caused it, but we saw that there is something that we take the DM2 as a group compared to the control as a group, and we see there is some different. So this is about quality of white matter. It's not like the white matter volume is different, but it's about quality. So if you think about quality of white matter, you need to think about if you have a very dense fiber, like you make a braid, and if your braid is very organized and very dense, it's very difficult for water to pass around, right? But if you have disorganized fiber, loose, one going to this direction, the other one go to the other direction, then the water could pass around in the brain. In the brain, there's water. I think that this kind of tell us that it's not about the volume itself, it's about the quality of the white matter. And what's the white matter do is basically connecting between the different area of the brain, and that could probably explain some of the cognitive symptoms in DM2. So in terms of cognitive dysfunction, after we look at all the data, we feel like there's 3 domains that pretty outstanding. I'm not saying that this would be like we will need to get more patient in and we make sure that everything is correct. But right now, executive function is very much like showing us that people have problem with planning, organizing skill. Episodic memory is also have some issue, and also working memory. And I will go through this category in detail. So if you have problem with executive function, episodic memory, and working memory, it might feel overwhelming because of you might feel like it's harder to manage your daily routine, sometimes easily to get distracted and having some problem planning or finishing task. And this is, like I said, changes in the DM2 brain can affect both structural, which is MRI, and also functional, which is a cognitive testing that we show. So what is executive function? So executive function is like the CEO of the brain, it's like the boss of the brain. So it helps you plan organizing tasks, managing time, stay focused. Having this problem could feel like subtle. The more it go on, then particularly if you could compare like what happened 5 years ago, what you have 10 years ago, it might actually affect some of the quality of life. So for example, if person sit in front of a bill or work assignment, and they might not know what to start, and they have a problem stay on task and finish things on time, and they could miss the deadline. They might have problem switching tasks from one to the other, like cooking while helping kids with homework, stuff like that. And most of the part that control executive function is on the pink, which is the front part of the brain, and that would something that most likely connecting with this executive function. What about working memory? So working memory is, it's not like you don't remember anything, you remember things. Working memory is like something that you hold information for a short time while you're using it. Like remembering the phone number just long enough to dial it. You go to the restaurant, they give you a bill, and you have to calculate the tips, right? And this is something that you have to do mental math. You might be able to do it very easily, when you are 30, 40, maybe, 50, something you used to be able to do it, then you can. So this is all working memory. It's about the connection Do you see the right figure? That's all the fiber of the white matter, not from DM2. This is just like a cartoon, okay? So basically, you need to have a good connection from, like I said, station A to station B. So you take a problem from the front part of the brain and then you send it to the different other place. So that is the way you hold up your working memory. What about episodic memory? Episodic memory is a little bit different. It's a kind of long-term memory, but its ability to recall a specific event or experiences from the past, like where, when. Okay, when was my first date with John? Like birthday of someone. That is something that represents episodic memory. So when people have problem with episodic memory, they could have problem difficulty recalling or organizing event and or sequencing thing. Sometimes they like following the recipe or instruction. Sometimes they have problem with social interaction because they forget the sequence of the event that the conversation has been going on, has been being discussed. And they might missing some step or doing thing in the wrong order. And it could be very subtle that you yourself thought it was just a bad day, or it might not be a thing until it become like more obvious. And also, again, this is a connecting part issue. So like I said, I think that the problem with DM2 is in the brain is real. It might not happen to everyone, but based on the data that we have, 2/3 of DM2 express some symptoms. And if you go and test these people, they might be pretty normal. And IQ is normal, every memory part is normal. And let me tell you, it's very funny because we have a control and we have DM2. So DM2 has one particular domain that score much higher than the control, and that part is telling you about the quality of your education. So you can have a very good education, high quality of education, and I have to use that part to adjust it to get a like non-biased result. And it's quite interesting that it's not all domain, and it's just some particular domain. Based on what we see is the white matter is a problem. Is that something new finding? No. Previous literature has been reported before, but they don't really link this with the cognitive function. What we have is the bigger data set that could confirm, and we have the cognitive testing that could be related with the part of the problem. So how do we changing modify lifestyle? We don't have the effective treatment yet, right? So for executive function, many people use calendars, planners, sticky notes. You have to make sure you break big tasks in small steps. It might not be like when you were 30, you can do everything at once. So now maybe when you are 50 or 55, then you may have to break things in small steps. Allow extra time for tasks. You might be able to do the exactly same task that you can do it in 30 minutes, but now it might take 45 minutes or an hour or even longer. And this is something that there is no evidence proof, but people saying that exercise even a little bit, have a healthy diet would support the brain function. I don't have anything to prove, but I think live healthy lifestyle would be good. Try not to multitask. If you have problem with that, focus on one thing at a time. Be kind to yourself, and don't just saying that I used to be able to do all this. Your brain is working hard. And of course, this is multi-systemic diseases. So, it's affecting the brain. And people talk about mindfulness or CBT, which is in Europe, they have done the study in DM1 and they feel it's helpful. And then I was saying that we should encourage social interaction. If you keep yourself active in your friends, I think that really help with executive function. And then know how to seek help. If anything's new or sudden changes, make sure you don't have something else. I'm not saying that you cannot have, everyone can have stroke, can have multiple, have different other things. And if you have significant depression, anxiety, talk to people who can help you. So we're learning more every year. And what we try to do is try to understand how the brain changes in DM2. What we don't have a longitudinal data. We don't know if what happened is going to stay like this or it will be progressed. We don't have that data right now. But you could make it different. So research in DM2 is growing, and we try to develop blood-based biomarker that connecting to the brain. And we don't have the data now, but hopefully we'll have the data soon. We still need longitudinal data that so we can determine, is this something that happened and never change, or it's something that happened and slowly changes. We don't know that yet. So together we are stronger and we move things forward. And so MDF is a great resources. You have DM2 support group. You have many of you running that group, and you can talk to your neurologist, and you could talk to us. You can reach out to us, and we have a poster in DM2 on number 28. This is not about the brain poster, but it's a muscle MRI, which is another biomarker that we have in DM2. That's all I have, but thank you for attending the talk.
Do we have any questions in the audience?
Hello, you mentioned some things like being socially active to help your brain. Are there, I guess I'm referring it to like muscles and use them or lose them. Can you do are there things like that with your brain? Say, play games on your phone, word games, math games, things like that. Are those helpful to?
Yes, it's helpful with executive function. And that's, remember, when people get older, they become kids again. When you teach your kids how to be organized, how to try to do things, make to-do lists and stuff, that is also executive function. But same thing that playing game, crossword, puzzle, interaction, having conversation with people, keeping yourself active, that actually helping a lot with that particular area in the front of the brain, which is control executive function. Yes, it helps.
Hi. I found that I'm having a lot of trouble reading. I can read, but then I forget right away what I read. And if I hear someone reading to me, I can process it a little bit better. Are you guys looking into that? What can cause that?
Not in particular at the moment, because right now we're looking at the brain in the big lobe, but we do have data in the different specific track and specific. If you see the brain, there is multiple like a waveform, and it's called gyras. So in different gyras in the different area, they represent different things. For example, reading is a language area with multiple part in the brain. Some of it's receptive reading, and some of them is expressive, like reading out loud. But what you describe could fall into episodic memory in the sense, or working memory in the sense that you can hold information for so long. And I don't have the data yet in the sense that what exactly the part of the brain that actually responsible for the reading. But what we see right now is more like changes in global phenomenon. But yeah, that could be a problem of working memory. When you couldn't hold things for so long, you read and you forgot. Is that right?
Yeah.
Yes. Hi.
So many of the symptoms of cognitive dysfunction in DM2 are similar to symptoms due to depression. How should I distinguish that? And would a neuropsych test help with that?
Yeah, we also collected the depression and anxiety score. We also collect something that DM1 is pretty obvious. It's called apathy score. It's very difficult to basically pinpoint whether or not there's some contribution from depression into these symptoms. But one thing is very clear is the brain structure has changed, right? If you have depression, your brain structure wouldn't change. So yes, I think, and basically the changes that we saw in the brain and the part of the particular memory that consistent with those vague symptoms, it explained whether or not depression will contribute and make things worse. That's a different question.
That makes sense. Thank you. One more question from online. They said, I tend to get brain fog after exertion. Is that common or is that a coincidence?
I don't know, because only on exertion, is that right?
Yeah, they said after exertion, they get brain fog.
One thing that I could probably try to link is because of DM2 tend to have diffuse fatigue, regardless of exertion or not. So doing some exercise may make fatigue worse. I don't know, maybe it's a little bit more brain fog. But there's a lot of things that need to be answered in DM2. I really think that one study wouldn't solve all. And We still need more people to work in DM2. Okay, all right. I think that I'm happy to take question off-site, and I'm happy to stay a bit longer. Thanks, everyone.